how do you select a graft for a ACL reconstruction surgery?
So for ACL, there are many graft options which are available. We can do what is called as a hamstring graft. We can do what is called as a quadriceps graft, BTB graft, Peroneus graft, and there are other some allograft also which are available nowadays, which are cadaveric, and then there are artificial grafts also available.
What is the commonly used graft?
So the most common used graft is hamstring.
Okay. So are there any advantages of this hamstring graft over the
Hamstring graft is a very simple graft to harvest. It's a very easy procedure that we do. Around 80% of our patients are hamstring tendons. You just need to make a very small 1-inch incision just below the tibial tuberosity. You take off your ligament. There is very less donor site morbidity. The graft quality is good. You have two graft there. You can take gracilis and semitendinous both. Here at Advanced Hospital, we take only semitendinosus, and that usually will give you a very strong 9mm graft most of the cases. So by and large, it is a simple to harvest, less donor side morbidity, quick harvest, and by and large, good result. So hamstring graft is the most commonly used graft in a primary scenario.
What other soft tissue graft you will prefer over the...
The second graft, that soft tissue I do, is a Peroneus graft. So Peroneus graft is taken from the ankle. It is on the lateral side of the ankle. So it's a very good graft, very thick tendon. The graft quality is very good. The tendon thickness is very good. The only question is you need to take a consent from the patient because you are taking a graft from the ankle. It is an extra regional site. You are not taking from the knee, you are taking from the ankle. And very occasionally we have seen patients getting some problems in the eversion, very rare. The eversion strength is little bit reduced. So it may be important in professional footballers like that. But otherwise, most of the patients, they are very good grafts and patients do very well after Peroneus graft. No donor side morbidity. So, and it is easy graft to harvest. So even for a beginner, it is a very easy graft to harvest.
So are there any bony grafts which are available?
So BTB graft, that is called as a bone tendon bone graft, that is the primary graft of interest, and this was the first graft with which the ACL surgery was performed. This is still the gold standard. It's a tendon between two bones. So basically you have bone plug on the tibia and you have a bone plug on the patella, and both of these are linked with a tendon, the patellar tendon. It's a very strong graft. Bone to bone healing on either side is very good, and the tendon has got a very good properties. So there are very less chances. One, the bone to bone healing is very good. So the recovery is pretty good and fast. The second, there is no late laxity because this is a patellar tendon and this does not stretch over time as compared to a hamstring tendon or a peroneus tendon which may stretch over time. So the rate of secondary loosening is very less with the BTB graft. That is why this is called as a gold standard graft. The strength is very good. The late laxity is not there. The chances of re-tears are very less, and the bone-to-bone healing is very good. So it's a very good graft. The only problem that we have with the BTB graft is occasional patients you may have an anterior knee pain, specifically the patients who are squatting down or kneeling down in position. In those patients, these BTB grafts may have anterior knee pain in some cases, and very, very rarely you may have problems of fractures in the patella. So that is the one or two drawbacks or setbacks. Otherwise, it's a very good and solid graft. Now, BTB graft is at present my graft of choice for any revision case. So, supposedly, if the patient is coming to me for any revision, primary graft, hamstring, peroneus, quadriceps, whatever it is, but still, my revision scenario, I would more prefer BTB than any other graft because one, the bone-to-bone healing is very good. You can tackle with that thickened or dilated tunnels. And then you can have multiple fixation options also for a dilated tunnel. And the strength is very good, the healing is very good. So again, BTB graft is my graft of choice for any revision ACL surgery.
You mentioned about quad tendon. What is the quad tendon?
So quadriceps is again a very, very good graft. It is somewhat between the hamstring tendon, that is a soft tissue graft, and BTB. So the properties are in between those, very less chances of late laxity. The tendon quality is very good. You can take a very thick tendon. You can take 9 mm, 8 mm, 10 mm as per your need. You can take length also. You can take 7 cm, 8 cm, whatever length you want to take, you can take. You can harvest it with either open approach or a mini open approach. So we are using what is called as a Quad Pro harvester for a mini open approach, but you can use it with a conventional open approach also. The quality of tendon is very good. The late laxity chances are very, very less. The healings are very good. You can take quadriceps with or without a bone plug. So you can take a bone plug of the patella also when you are taking a quadriceps. So that is again an advantage. But you have to be careful because taking a bone plug on the top of patella has got a slightly higher chances of fracture as compared to a BTB because that is the lower pole of the patella. So higher pole of patella, more chances of fracture, but still can be taken safely. So in our practice, most of the time I take a soft tissue quadriceps graft. Occasionally I take a bony quadriceps graft, and typically in the revision scenario, I may take a bony plug because it is easier to fill the dilated tunnels and you do a bony fixation. So occasionally if I am doing a revision scenario and I can use a quadriceps for that, and in those scenarios I will use a quadriceps with a bone plug. Otherwise, most of the cases I will use a soft tissue bone plugs, and I'll use quadriceps specific buttons. So nowadays, many companies have come up with a quadriceps specific buttons. These buttons can be used for flat tissues. There is a button called as a fiber tag tightrope. This is from Arthrex, and all other companies also make it. And these are basically specifically dedicated buttons for flat graft. You don't have to loop the graft around the button, but you can fix it with special technique. So these newer buttons have given us a lot of advantage for flat graft. So nowadays quadriceps is also one of our favorite grafts for primary ACL. So if the patient needs a very quick recovery, faster rehab, and good strength of graft, specifically he's an athlete, we can go away with the quadriceps graft as well.
So we talked about the autografts which are available. Are there any allografts which are there?
So nowadays allografts are also available. There is one company in India which is supplying allograft, but still there are issues, some medical legal issues, some issues of transmitting infections, and some issues of transmitting the viral things. So still it is not getting popularity, but now yes, allografts are also available and we can use them in multi-ligament scenarios.
Okay. So are there any advantages of the quadriceps tendon over other two, or?
Yes, so quadriceps, the strength is very good. You have modularity to choose the thickness. So you can have the liberty to choose the thickness and the depth of your graft. Usually you can take 8 mm, 9 mm, 10 mm as per your need. You can vary the depth also if you want. What I personally do is I keep the inner layer intact. So I usually take the superficial 2/3 of the quadriceps. So by that, I don't violate the capsule, and the strength of the quadriceps is also not violated. And my suprapatellar pouch is also not violated. So that is the advantages. The strength and the recovery of quadriceps is very, very good because you can do hamstring exercises. So there is no hamstring atrophy. But still, I would not recommend quadriceps for short Indian females. So for them, the quadriceps is length is short, and the quadriceps strength is also not good. But it's a very good graft for athletes. Artificial grafts is also one thing which is new. So nowadays there are synthetic grafts also which are available, which is called as a Kairos or Jewel ACL. So these are polyethylene grafts. These are basically the textile fibers, and they are interlaced in nature. So what they say is there is a ingrowth of fibrous material into that jalidar structure. So this structure is there, and there is a fibrous ingrowth into that porous structure, and that is very good because they in follow-up studies they have demonstrated there is a fibrous healing inside the artificial ligament per se. So this is supplied from the company which is called as a Kairos, and we can use it for a limited indications. We are not using at present for all the cases, but definitely prospective, and its use will increase over time. The negative factor to it is the cost, because cost is prohibitive. They are very expensive, and for one thing, the autografts are available for no cost. So that is why the artificial grafts are not getting the popularity that much, and still a lot of work and a lot of research needs to be done on that front.
Thank you.
Thank you.